I wonder how many of you or your friends or relations have tried to get an NHS dentist over the course of the last few years. I think in most parts of the country, it is pretty much impossible, which is why in the St Paul's district of Bristol, when it was announced that a dental practice was going to start taking NHS patients, they started on Monday queuing round the block. And if you have a look, literally today, they're still queuing. They're going to go on queuing for day after day after day in the St Paul's district of Bristol. But the government have made some quite big, bold promises. Have a listen to Victoria Atkins, the Health Secretary.
The plan that we're announcing today ensures that we are getting dental care faster, simpler and fairer towards people that really need it. For example, bringing dental vans into those most underserved areas across the country. I'm a rural and coastal constituency MP. I know how tough it can be to find a dental appointment locally. We'll be rolling out dental vans to help in the immediate term with some of those issues. We're also ensuring that NHS dentists are being paid more to look after people. We're going to be creating some 2.5 million more appointments as a result of this plan. This is really good news. There is more to do. We absolutely accept that, but this is going to make a meaningful difference to people's health.
Well, no one doubts the importance of dental health, not for one moment. But I wonder, are the government claims correct? Can we believe them when they say they're going to create over the next few years millions more appointments? And is paying dentists 20 grand each the right way to go about it? Well, I'm very pleased to be joined down the line by Neil Carmichael, chair of the Association of Dental Groups, and of course a former member of Parliament himself. Neil, you get the point. You know, it's been so difficult for people to get an NHS dentist. If you take at face value what the government is saying, and indeed what the opposition is saying, good times are just around the corner. Would that be a fair assessment?
Well, those good times will come if we get enough dentists. The big problem is actually the number of dentists able and willing to do NHS work and indeed private work too. We are chronically short of dentists. We need to have more dentists so firms can and businesses and practices can recruit them. And so I'm saying that the GDC has got to sharpen up to the challenge, which is basically to get more dentists on the register so they can start practicing.
Is this one of those areas where people qualify and then go to other parts of the world to be dentists because it's that much better paid?
Well, certainly, if you look at the situation in the United Kingdom, we've got some very good dental schools, but they don't produce enough dentists. It's not their fault, they're capped. And even if we were to remove the cap completely and basically enable them to train as many dentists as possible, that's still immediate impact because, of course, a dentist takes a long time to train. So what we've got to do is make sure that dentists that are capable of doing the work are actually put onto the register now. And that's the problem. That's the challenge.
Right. So it sounds to me like actually this is another problem with an exploding population. No government could ever estimate this massive increase in population, so we're short of dentists. I mean, I know that with doctors and with nurses...
I don't think it's an exploding population.
Right. Well, if you have more people and the same number of dentists, you have a problem, don't you?
Well, we need more dentists. We've got 40-odd thousand on the register, which is good, but not all of them do full-time work. That's a lifestyle choice that they have made, and quite right so. We just simply need to get more dentists. There are more dentists. There are about 2,000 dentists who could easily do the work if they were on the register now. That's what we need to do. 1,000 more dentists equals 750,000 more appointments.
And so how do we encourage people who are already qualified to go full-time in dentistry or to come back to it?
Well, the government's package is attempting to do that. We've seen the measures that they've taken. They're well documented. We'll be hoping to, let's say, enhance them as the months and years go by. But actually, if you're talking about the contract, it needs more fundamental reform. This is a sort of incremental set of measures. which will do some good. But the fundamental question, incremental measures or not, is how many dentists we've got to recruit. And if we can't recruit them because they're not available, that is unhelpful.
OK, so the government can promise all these things, but without more dentists, it can't be delivered. That's really the nub of it.
Well, if I was Secretary of State for Health and Social Care right now, I would be making sure the GDC understood clearly that actually there are dentists there to do the work. It's just that they need to be registered. And the quicker that they are registered, the better things will be. And by the way, we are not saying that dentists should be just put onto the list if they're not good enough. That's not what we're saying. What we are saying is good dentists should be registered and registered as soon as possible.
OK, Neil Carmichael from the Associated Dental Groups, thank you for joining me live on the programme. And it's funny, isn't it? Doesn't matter who you talk to. You can talk to people in housing, you can talk to people in all sorts of areas. And if you point out that, our population increased by migration last year by 750,000, and therefore we're short of things, everyone, it seems, is in denial about this within the professions, within much of the media, but I don't think you at home are in denial over it.